South Africa has a high rate of child abuse, with many children experiencing or witnessing some form of violent abuse. According to the Department of Social Development, more than 26,000 cases of child abuse were reported in the 2024-2025 financial year. Recognizing the signs and being aware of the different forms of abuse is key in the prevention of abuse within a household. Now, this morning in our Health Matters segment, we look at the worrying scourge of child abuse and what parents and caregivers can do to protect their children. Joining us virtually, we've got Dr Sanelisiwe Nellie Balfour, a specialist pediatrician. Dr. Nellie, thank you. Thank you very, very much for being with us here on the program.
Thank you so much for having me, Leanne.
So it's always an uncomfortable topic for parents, and we never really know when the best time and age is to talk to our children about sexual abuse, sexual exploitation, and the likes. Perhaps you can give us some guidance on that.
So I think when speaking to our kids about any kind of abuse, not just sexual, but I think physical too, we need to start as early as possible. And I think a lot of parents are apprehensive to have the conversation because they believe that it needs to involve a lot of information very soon with big, complicated words. So what I usually advise is to avoid these complicated words and terms for kids. Keep it at a level that they will understand according to their age. So use simple words, particularly, for example, a toddler who just has started understanding, the language that comes with all of this versus a teenager. So we basically will start with talking about body parts first. I know a lot of parents are scared to name private parts for what they are, but we need to name them for exactly as they are. So a vagina and a penis are named the same way that we name a face, an elbow, a hand, a foot. Kids need to know exactly what their body parts are called, because in the future it avoids any kind of confusion, and it makes them confident enough to come forward and name these things if anyone violates them, unfortunately. We also need to talk about consent when it comes to kids. So we need to speak about how children shouldn't be touching other children's body parts, and not just about their body parts not being touched. Because I know a lot of parents speak about, these are your private parts. People shouldn't be able to touch them without your consent or without you saying so. But we also need to instill in them that other people's body parts are also private and they shouldn't be touching them either. We need to speak about secrets, because a lot of the perpetrators and these predators who prey on these children tend to make kids keep these things a secret. Yeah. And that's what perpetuates the abuse in these kids, or makes the abuse go on for much longer than it actually needs to.
Absolutely.
So we teach them about secrets, and if anyone tells them, don't tell your parents, or threatens their parents with anything, that they go to a trusted adult and tell them immediately.
Yeah, and this is the thing. Also, I'm going to interrupt. I'm going to quickly interrupt you there.
Yes.
Thank you. Thanks, Dr. Nellie. We don't have too much time, but I know what you're telling us is very, very important. And these are the things we need to look out for. And also grooming, because grooming is probably one of the biggest things, because as we hear, a lot of the times, the children or the victims actually know those that are perpetrating against them. And they're friendly with the parents, and they think it's okay because uncle, or teacher, or whatever the case may be, those trusted adults are the ones that prey on these children. So what about grooming and these kind of things?
So 100%, grooming is something that we take quite seriously and that a lot of parents aren't aware of. So the majority of sexual abuse cases that occur happen at the hands of someone that the child knows. So grooming comes in many different forms. It basically just means that whoever is preying on these kids gets these kids into a certain vulnerable state, and in a position where these kids start to trust them, to the point where they can basically violate these children. So we do see a lot of grooming, and grooming tends to happen in a lot of different forms. What we've seen nowadays is grooming even happens with peers. So we've seen a lot of grooming happen when it comes to devices, and adult content on devices. So we see perhaps maybe if there's a case of a teenager having abused a younger child, they groom them by exposing them to a lot of adult content on devices, which kind of desensitizes children to this type of thing. And then it kind of leads to these situations where the other adults or the teenagers end up saying to the kids, why don't we reenact this? And then that leads to further sexual abuse of these children.
And this is something that we need to look at. I mean, and following by numbers, according to the Department of Social Development, there's deliberate neglect being the second most prevalent in all provinces with 9,485 cases, followed by physical abuse with 3,965 reported cases, and then 595 cases of abandonment. These are very worrying numbers.
Yeah, incredibly worrying. So I think a lot of people aren't aware that neglect is a form of abuse. I think it's the most ignored form of abuse because people tend to focus more on sexual and physical abuse, even though there is emotional and neglect also. So I think also a lot of parents who kind of commit the neglect don't know that it's neglect, and deliberate neglect at that. And we've had a few cases in which neglect has led to physical injuries in children, as well as exposing them to sexual abuse by other people. And it's not lost on me that due to a large proportion of our population having a lower to middle socioeconomic status, neglect is something that's really, really common. I mean, we've had some parents leave their children in the care of other children or leave them on their own in order to seek help or seek work, or leave them to go and attend to other social activities. So we do see quite a lot of neglect, which leads to more dangerous issues in kids.
Yeah. If we have to look at some of the ways that we can create safe environments for children and reduce these incidents of child abuse, what do we need to do?
So I think what I addressed at the beginning is by having these types of conversations, because once kids are used to this language and these conversations, it's going to be easier for them to come to a trusted adult to tell them if anything happens to them. I think it's important to also tell kids that we trust them, we are going to protect them, and we'll believe them if they tell us anything. Letting kids know that they won't get into trouble for telling the truth is something that's quite big, because I know a lot of children are scared to come forward with this, thinking that they won't be believed or thinking that they'll get into trouble. So I think it's just about keeping that open line of communication with kids, letting them know that you'll definitely protect them and that it's never ever their fault.
And that is it's so important. It really, really is, because they've got to live with this for such a long time. How do we encourage children to speak up? And I mean, or even witnesses to speak up?
So I think by creating a safe environment for kids and witnesses to speak up. And I don't think we particularly have a very safe environment in our country for kids to speak up. I know that in a lot of cultures and a lot of parts of our country, kids aren't really taken seriously or aren't listened to. So I think basically by fostering a safe environment in which kids feel safe enough to come forward because they feel listened to and they feel heard. And even with anyone who's seen this type of thing, so any witnesses, if they feel safe enough to go to our police services, the police service is basically putting it out there that they trust them too, that they won't, make them feel less than, belittle them. They'll take them seriously, that everyone will take them seriously if they come forward. We do have a bit of a problem in our country also with regards to certain health professionals encountering child abuse. A lot of people are very apprehensive when it comes to dealing with child abuse, and they would prefer not to deal with it. Yeah. So we unfortunately have had a lot of children who have sought medical care and who haven't gotten the care that they need because people don't want to be involved. And that's where we come into play, the Teddy Bear Foundation and the Teddy Bear Clinic.
Yeah, just a final question, and very quickly, signs to look out for. I mean, are there really standout signs that parents, caregivers, anybody should look out for in an abused child?
Definitely. So a lot of parents know their children and they know who their children are and how they are. So usually when they see a change in behavior, that's when they should be aware and red flags should be raised. Right. So we typically see with abused children, they become more aggressive, they become a bit sexually inappropriate, they become a little bit more withdrawn and quiet, a bit more clingy than they usually are. And I think one of the major red flags is just their changed behavior around someone who they were used to and that they used to have a good relationship with. So these are typically the things that we tell parents to look out for, particularly in the kids who are nonverbal or haven't started speaking yet.
All right, we leave it there. Thank you. Thank you, Dr. Nellie. Thanks for talking to us about this.